Welcome to AARC TV. I'm Rachel Kopchak.
And I'm Ed Highland.
Day 2 of AARC Congress 2017 kicked off with the official annual business meeting.
Inspiring reports from the current AARC leadership were presented.
Some of the highlighted accomplishments included the development of 5 new baccalaureate programs since 2014 and new programs launching in 2018 that will be required to convey a baccalaureate or graduate degree.
AARC President Brian Walsh reflected on the quality challenge facing RTs. The U.S. has a higher mortality rate than other high-income countries, and RTs will need to continue to evolve in order to keep up with demand.
For the education section, this is a very exciting time. There are strategic goals that the AARC has and will be integral to that. There are education-related position statements moving toward the baccalaureate degree, and the education section members will help participate in that plan.
The 5th annual Thomas L. Petty Memorial Lecture was presided over by Dr. Maylon Hahn. Dr. Hahn's lecture focused on how patients with COPD and the providers who care for them face unique obstacles, particularly in the current healthcare environment.
Dr. Hahn addressed reports of women being almost twice as likely to die from COPD as opposed to men, and patient findings as to why that takes place. Some of her key points were directed toward emotional impact of delayed diagnosis, the need for better treatments, and poor access to pharmacological treatments due to cost.
Patients with COPD tend to be socioeconomically challenged, and if we look at the breakdown, particularly in terms of annual income, it's women in particular that are at or below the poverty level.
In respiratory therapy, good days for your patients and their families are the goal. At Gettinga and Arjo Huntley, we are proud to be your trusted partners providing innovative healthcare solutions with brands you know and rely on. Please join us for the Gettinga Sunrise Symposium and gain valuable insight into the importance of an active diaphragm and ventilator, working in synchrony through personalized ventilation. With Gettinga and Arjo Huntley as your partners, together we make good days.
You're watching AARC TV. I'm Rachel Kopchak, and I'm here now with Mark Burke with Gettinga to get to know Gettinga. So what do we need to know?
Yeah, thank you. So at Gettinga, we're proud to be a trusted partner, providing innovative healthcare solutions with brands that our customers have come to know and rely on. Early this year, Gettinga unified our names under one brand, including McKay, Datascope, Atrium, and Pulsion, under the name Gettinga. This showed and simplified for our customers our expertise and dedication in the acute care therapies as well as in surgical workflows. So regardless of your procedure or your therapy, in the operating room, in the critical care environment within the ICU or the cath lab, Gettinga's passion for life is revealing itself every day in everything that we do and everything that we make.
And you've made these wonderful changes. So how is that impacting the customers and also the hospitals?
Yeah. Now more than ever, Gettinga understands the importance with our customers' number one objective, which is providing positive outcomes. And that can only be accomplished through best-in-class products and through the first-class leading edge with providing customer service, applications, and product support. So we are proud to continue our sponsorship with AARC and the respiratory therapist in the United States and within the world. And we look forward to continuing to have better days together.
Thank you so much, Mark. We appreciate your time. If you want to get to know Gettinga, you could come visit their booth here at AARC Congress. Ventilator asynchrony is a very common problem in mechanically ventilated patients that can go unrecognized. Respiratory therapists and clinicians learn how to recognize abnormal waveforms and what to do about them.
The most common one is trigger asynchronies. And trigger asynchrony would be where that you see this patients in exhalation, you see this increase in expiratory flow at the same time you see a drop in the pressure waveform when the patient should be in the expiratory phase of the breath.
The big takeaway was just mainly looking at the flow and adjust that according to the patient. You don't want to ever just look at the waveform and not look at the patient and see what the patient is doing.
Healthcare in general is looking for more value for their dollars, including here in respiratory care. How do we quantify the value of a respiratory therapist? Well, you can look at things like how well they meet the hospital's mission statement and how well they protect the patient's outcome in terms of safety, comfort, and liberation from our healthcare system.
I gave objective ways that we could rank individual things that we do. We can also look at the value of the labor associated with it, how much skills it take, how well people perform in terms of the performance evaluation, how much they cost in terms of their wage and dollars per hour.
It is very difficult to put a value on what respiratory care does and to give a good productivity number, which is the normal type of thing that we're asked to do.
With over 200 exhibitors lined up to showcase the very latest technology, you can bet there's something new and exciting around every turn on this exhibit floor. Let's take a look.
I really enjoy getting to see the new equipment that's coming out, different techniques that differ from the hospitals that I've been in for clinic.
We come to visit our suppliers because we are distributors in Mexico.
The exhibit floor is just awesome. You can't even describe how big it is, and the exhibitors that are in there, the amount of respiratory products that are available to see, you just can't get that anywhere else.
Learning continues at AARC Congress 2017 with this session on non-invasive ventilation and the bedside decisions you have to make during critical care transport. Some of the challenges in the transport world are whether to intubate or keep a patient on BiPAP. Here's some advice.
The big thing for me is ARDS, and when we put people on non-invasive ventilation for ARDS and we have these really significant decreases in PF ratios, not the best thing to use. I think we spend a lot of time wasting good patient care with folks that are on non-invasive ventilation when they should have been intubated, had some PEEP involved, and maybe some other issues to treat the ARDS.
With AARC's set goal for 80% of all respiratory therapists to have a bachelor's degree by 2020, Dr. Ellen Becker highlighted the ways that educators in associate and baccalaureate degree programs can help RT students in associate degree programs complete a bachelor's degree.
As educators, we need to work on developing articulation agreements, helping students figure out credits that transfer, and we have some great resources.
As you can see, AARC Congress continues to help you deliver quality care to your patients. I'm Rachel Kopchak for AARC TV.